Hello everybody, this is Dr. Medicine RX and in today's video we'll be discussing about Henoch, Schönlein, Purpura. So Henoch, Schönlein, Purpura is a small vessel IgA mediated vasculitis and it is the most common type of vasculitis seen in children. Coming to the epidemiology, we've got a slight male preponderance. However, it can be seen in both males and females to the same ratio, and it is commonly seen in the age group of 4 to 6 years of age. However, it can also occur in children older than this age group and also in adults, but the disease is more severe in adults and has serious consequences. Coming to etiology, we have got to keep three factors in mind. First are the genetic factors, second is the infection, third are the environmental factors. Coming to genetic factors, it is commonly seen due to gene polymorphism such as HLA-P35 and HLA-DRB1, and it is also seen commonly in association with infections. It usually follows upper respiratory tract infections. It is most commonly associated with group A streptococci. However, other bacteria such as Helicobacter, Haemophilus, hepatitis A and B are also responsible. It can also follow viral infections such as varicella, adenoviral, and also Coxsackie viruses. Next, coming to environmental factors, it is most commonly seen in spring and winter seasons. The fact being that infections, upper respiratory tract infections, are more common during these seasons. Now, coming to the pathogenesis, IgA1 immunoglobulin plays a fundamental role. We all know that IgA is of two types, IgA1 and IgA2. In Henoch, Schönlein, Purpura, IgA1 plays the most important role. There's something called as an hinge region between the FAB and FC portions. In IgA1, the lack of glycosylation at this hinge region leads to the formation and deposition of IgA immune complexes, which further release inflammatory mediators and thereby cause inflammation. The IgA deposits in postcapillary venules of skin, mesangium, joints, and GIT as well. Now, coming to clinical features, first off, we've got the basic prodrome where there's symptoms such as headache, fever, and anorexia. Then we've got something called as tetrad of Henoch, Schönlein, Purpura, where you can remember H for hematuria and P for purpura, and along with two A's, that is the abdominal pain and also arthritis. Now, coming to purpura, which is usually palpable and it is of 2 to 10 mm in diameter, it is commonly seen in the extremities and also the weight bearing areas of the body. So, in children, in younger children, it is seen on the back, upper limbs, their gluteal region, that are the buttocks, and also in the thighs. Whereas in older children and adults, they are seen on the lower legs and ankles. The face, palms, and soles are spared. However, they can be involved in infantile Henoch, Schönlein, Purpura. Next, coming to renal manifestations, there's microscopic hematuria, gross hematuria, proteinuria, nephritis, and end-stage renal disease. Microscopic hematuria is most common, and proteinuria is present only if there's hematuria and is seen most commonly in about 60% of the cases with hematuria. Nephritis is most commonly a complication that is seen in children and it develops within 3 months but is usually preceded by cutaneous lesions. Of these, 3% may develop end-stage renal disease requiring a transplantation. Usually, the cutaneous symptoms will last for 2 to 12 weeks. Now, coming to the J involvement, the most common clinical feature is colicky abdominal pain, along with nausea, vomiting, hematemesis, and melena. Bowel obstruction is most common, of which intussusception is the most common type of bowel obstruction seen in children. It may further lead to bowel infarction as well. Now, coming to the joint manifestation, it usually affects large joints such as knees and ankles. It's very painful. The arthritis is very painful and also one of the criteria for diagnosing Henoch, Schönlein, Purpura. Next up, coming to the respiratory manifestations, due to diffuse alveolar hemorrhage, pulmonary hemorrhage, and effusion, there can be respiratory distress. Hypertension is another one of the clinical features, and neurological manifestations include seizures, intracranial hemorrhage, and focal neurological deficit. In adults, if IgA vasculitis is present, it runs a course that is different than the children. It is very severe, most severe. Instead of palpable purpura, there can be progression to necrotic skin lesions, and there's chronic renal insufficiency and usually require vigorous long-term treatment. Coming to investigations, there is no test as such to diagnose HSP. The diagnosis is clinical. We've got a diagnostic criteria where the essential criteria is palpable purpura. That means that it should be compulsorily present while diagnosing a case of HSP. Along with this, we need to have at least one of abdominal pain, acute arthritis, hematuria, proteinuria, and a biopsy showing IgA deposition. The other clinical tests include complete blood count with the platelet count because there's hemorrhage. Then we need prothrombin time, blood urea nitrogen level, creatinine level, urine analysis, and biopsy. On histopathological examination of the skin lesions, we usually see leukocytoclastic vasculitis with or without fibrinoid necrosis, and of course, there's perivascular IgA deposits in mesenchymal blood vessels. Along with IgA deposits, we can see C3, IgG, and fibrin deposits. Now, coming to management, supportive therapy is the main course of management. So we give non-steroidal anti-inflammatory drugs for pain. Then dapsone and colchicine are two main important drugs in the management as they decrease the duration of the disease. And also systemic corticosteroids, they are very useful if there's systemic features present and also in case of severe nephritis. All in all, systemic corticosteroid reduce the duration of skin lesions and also reduce the course of the disease. Intravenous immunoglobulins and immunosuppressants, other immunosuppressants are useful in long-term disease and also severe disease. Thank you, and for more such crisp content, do subscribe to Dr. Medicine.